Two doctors who've helped Singapore fight COVID-19 have received this year's UK Chevening Scholarship. They'll be pursuing master's degrees in the UK soon. The programme aims to develop leaders academically and professionally within their fields. And they join us tonight. Dr Taufeeq Wahab, resident with the National University Health System, and Dr Glorijoy Tan, Associate Consultant for Infectious Diseases at NCID and Tan Tock Seng Hospital. Good evening to both of you. Dr Taufeeq, you were involved in dealing with the COVID-19 outbreak in the foreign worker dormitories last year. Can you describe that experience for us?
Yep. So I think at that time I was actually a medical officer in the SAF, and I actually got sent down to Joint Task Force Assurance to help out. And it was when the dormitory outbreak was really emerging at that time. So we had two tasks. We had to provide medical support for our dormitory residents, and we also had to try and catch the infections before they spread in the dormitory. So we really had to use various technologies. We had to use sewage testing. We used swab testing. We even looked antibody testing. And as our capacity grew, we used all these strategies. And that's how we really managed the outbreak in the dormitories.
Dr. Taufeeq, what was the most challenging for you, and what areas do you think Singapore can improve on when it comes to pandemic control?
So I think the most challenging was really trying to work with so many agencies. There were so many ministries, agencies, independent teams, and you had to really adapt to the working style. And as a medical team, you had to put forth your medical policy, and you had to provide the concepts. You had to explain the intent behind what you're doing. I think regards to the second question about pandemic response in Singapore, it's a good question. I think a lot of countries are looking to what they're doing. I think at the end of the day, how we've done is really born out of experience and our technology. So what happened in SARS in 2003 has influenced us now. And what happened last year is influencing the pandemic now, this year. So, and how we manage Delta variant and the technologies, it's really expanded. I mean, we started with just PCR tests. Now we have antibody tests, we have antigen tests, we do switch testing. People are looking at saliva testing and breathalyzer testing, and it's just really expanding beyond what we had before. And on top of that, we're even using Bluetooth technology to do contact tracing. I think that's really amazing. So it's really anyone's guess to say what's going to happen for the rest of the pandemic or really what the next pandemic will be. But I think as long as we stay grounded in the public health principles and we continue to innovate, then we'll be prepared for the next pandemic.
We certainly have so many more options now. Dr. Tan, you were awarded the scholarship last year, but we understand that you put it off to keep up this fight against COVID-19, also in the migrant worker dorms. What was it like making that decision?
Well, I think 2020 was a very uncertain time for everyone, including myself, and we were all facing a novel pathogen that we knew very little about. There were many concerns that, a rise in cases may result in a sudden surge in hospitalization rates. And so there was really a need to safeguard our healthcare system. So while on one hand, I was delighted to have been awarded the Chevening Scholarship, on the other hand, I also felt a great need to stay together in solidarity with my fellow healthcare workers as part of the frontline pandemic response. I was therefore very fortunate and grateful to the Chevening Secretariat that provided that option for me to defer my studies to the next academic year, and on grounds only that I was a frontline healthcare worker.
Dr. Tan, in what ways do you feel COVID-19 changed the way medical professionals like yourself work?
I think the pandemic has dramatically changed the way people view infectious diseases as a whole. The fact that it is far-reaching and no one is really spared from its reach. But to answer your question, I can think of two main domains. I think firstly, the way in which we think about and design our infection prevention and control measures are now more nuanced towards the various environments in which they are being applied to. Traditionally, we think of measures implemented in places such as the hospital and healthcare system, but we realize the importance of applying these measures as well in community facilities, community settings, places like the hawker centers, airports, etc., because we know that transmission can occur in these places. I think the pandemic has certainly helped us to improve on these strategies to prevent onward transmission of such infectious pathogens. And overall, I think our flexibility and knowledge of this has helped us to control the COVID pandemic in Singapore. I think the second way that our work has changed is really our need to be adaptable and nimble to whatever comes our way. The pandemic has thrown us many curveballs, and we have had to gather data very quickly. We have had to collaborate internationally. And this pandemic has laid groundwork for us to prepare us for the next novel pathogen. As Dr. Taufeeq mentioned, this will not be our last pandemic. We are preparing ourselves for virus X, virus Y. And I think the lessons learned from this will be proving ground for the next pandemic.
Dr. Tan and Dr. Taufeeq, both of you are going to be pursuing a Master's in Public Health at the University of London. Very quickly, what will your focus areas be, and how do you anticipate translating that into your work moving forward? Dr. Taufeeq, perhaps we'll start with you.
Yep, so the school we're going to has actually a very good history of research and contributes a lot to global health, and that's part of my interest. I think I want to meet like-minded people like me who are interested in global and regional public health. And it's really about coming together and trying to inspire others to look for gaps in population health. And we're trying to address these gaps so we can have more holistic healthcare for all. I think that's really what I'm looking forward to.
And Dr. Tan?
Yeah, as part of my work currently as an infectious diseases physician, a lot of it is really centered on understanding transmission of infectious diseases and mitigating them through policies and measures. So I think a lot of my further studies will be focused on these areas, specifically epidemiological analysis, health economics. And I think these skill sets will put me in good stead to return and serve the nation better.
Well, thank you both for joining us this evening. Congratulations to you both on the scholarship. Dr. Taufeeq Wahab from the National University Health System and Dr. Glorijoy Tan from the National Centre for Infectious Diseases and Tan Tock Seng Hospital.